Dr. Liv with New Insight, and thank you for joining me in another video. In today's video, I will be discussing an overview of personality disorders and the impact on interpersonal relationships. Personality is influenced by genetics, but also by one's family upbringing, culture, religion, education, and their life experiences. Having a personality disorder has nothing to do with a person's race, intelligence, accomplishments, religion, or socioeconomic status. And personality disorders are also classified as mental health conditions. A personality disorder represents a pervasive, persistent, and significant impairment in four main areas of a person's disposition. These four main areas are cognitive, emotional, interpersonal, and impulse control, which basically means there is an impairment in the way the person thinks, feels, acts, and responds to people and situations. When an individual has a personality disorder, there is a distortion in the person's thoughts, beliefs, and perceptions. There is instability and dysregulation in their moods, and their behaviors are impulsive, unpredictable, and unconventional, which basically means they typically do not respond to people or situations in ways that culture, society, or family norms would deem appropriate or acceptable. They tend to overreact, underreact, or not respond at all to situations that would typically elicit an emotional or behavioral response. And many may seem paranoid, suspicious, disinterested, and detached. They may also have little to no desire to establish interpersonal relationships or participate in social activities. They may prefer to be alone, and many are physically, mentally, and emotionally withdrawn. They may be apathetic, limited, and restricted in their ability to recognize and reciprocate appropriate social cues and responses. And because of these behavioral characteristics and mannerisms, others may label these type of behaviors as being bizarre or odd, immature, immoral, irrational, weird, over the top, delayed, slow, psychotic, antisocial, or debaucherous. There are three clusters or categories of personality disorders. Cluster A is known as the odd and eccentric category. It includes paranoid, schizoid, and schizotypal personality disorders. Cluster B is known as the dramatic, emotional, or erratic category, and it includes antisocial, borderline, histrionic, and narcissistic personality disorders. And Cluster C is known as the anxious and fearful category, and it includes avoidant, dependent, and obsessive compulsive personality disorders. And it is important to understand that individuals diagnosed with a personality disorder have a different way of thinking, feeling, and behaving from other people. And although they may have similarities as those without a personality disorder, their entire disposition is based on distorted, dysfunctional, and unstable thinking and behavioral patterns. And these traits are deeply rooted, very rigid, fixed, and pervasive or widespread. It is who they are and who they have either learned directly or indirectly to become. Therefore, in interpersonal relationships with them, you may not receive the balance, reciprocity, stability, or security that you need. Their thinking is very rigid and oftentimes based on cognitive distortions or thought traps, and it is nearly impossible for them to consider or accept other perspectives and to be rational, reasonable, or to compromise. Their reality will look very different from yours and others. And as a result, many may be paranoid, suspicious, and mistrustful of you. They also make decisions based on impulsivity and immediate gratification. And because it is difficult or nearly impossible for them to exhibit appropriate behaviors, this, of course, affects the way they show up in interpersonal relationships, meaning the way they talk to you, treat you, respond to you, their habits and mannerisms, and overall decision making. Therefore, in a relationship with them, if you are able to connect and establish one, the relationship will be very one-sided, unpredictable, dramatic, unstable, mentally and emotionally draining, and perhaps codependent and toxic. And there may even be some form of abuse or neglect, and dysfunctional or high-risk behaviors and habits. And this is because the personality disorder causes them to have an unhealthy disposition, and because many are unable to give and receive healthy love. And depending on the type of personality disorder, they may not even want or desire warmth, love, or connection. They may desire sex and more superficial interactions, or no interactions at all. So, what is the treatment for personality disorders? Treatment includes a combination of individual and group therapy, psychoeducation, and medication management. The interventions used in individual and group therapy are typically based on CBT, or cognitive behavioral therapy, or DBT, dialectical behavior therapy, and psychoanalytic or psychodynamic therapy. Psychoeducation is used to teach the individual and family members about the personality disorder, treatment, and to teach coping skills. And while there are no medications specifically used to treat personality disorders, practitioners may prescribe mood stabilizers to help with anxiety, depression, or mood regulation. So knowledge is power. It equips you with the understanding needed to make more intentional and informed decisions.